self-medicating behaviors involving multiple substances of abuse. These include alcohol, opiates, benzodiazepines, and stimulants, cocaine. Is that accurate what he told you?
Oh, what's with the cocaine?
Yes, that's in my, that statement's in my...
All right, I'm listening to Dr. Kipper. David Kipper. I've been waiting like forever to listen from this guy.
Was Mr. Depp.
The thing that I have with this guy is like, why? I mean, I understand he's like trying to cover his ass because he's like a big doctor in LA and stuff, but he doesn't, like, if people don't know what this is about, they're going to think that it's all the same. Like Xanax and Valium, which is the benzos for anxiety, are the same that the mood stabilizers. It's the same that the Ambien, which is sleeping medication, the same as Seroquel, which is the mood stabilizer, which is the same that opiates, the same that weed. By the way, weed is legal in California. So I didn't hate Dr. Skipper. Like, he was not a bad witness, but I don't like that he was not making any distinctions between legal or illegal drugs, or really what was this about? Because like the regular person that doesn't know anything about this, the jury that was like standing right there, will just listen to the doctor and be like, okay, well, oh my God, this guy was in all these things. And they're not explaining why he was taking the things for. And I listened to the 2 hours back and forth, and I really didn't find anywhere in the whole thing of Dr. Kipper saying, well, I gave him this because he has bipolar, because he's this. They were just talking about how he was not okay. All right. He was having issues, stuff like that. Like, I found it was very vague. When people that don't know anything about substances or mental health and whatnot hear those words like opiates and marijuana and whatever, like, they don't think, oh, well, there got to be a reason why this person is taking this. This person is taking this because he's been detoxed, or he's been weaned off of a medication. I feel like our love for him, I don't know if he's coming back, the witness, Dr. David Kipper, to kind of like explain more why Johnny Depp was taking that stuff, instead of just making it sound like, well, he was just taking the stuff, and maybe it's not really like his fault, but whoever was doing the deposition by video. So I guess it's not the doctor's fault, but whoever was doing the deposition by video was like, it messed it up, because they didn't really ask the right questions, which is like, was his diagnosis, if any, bipolar, which he admitted that he had, but is this doctor knows that? Is this doctor's ever diagnosed with bipolar? What is it? Because they're mixing up the behavior addictions with the substance addictions, and it's a total different situation. And they go from the anger issues to he was smoking too much weed, to the opiates, to detox from the benzos. It's really confusing, not to me, but it's going to be very confusing for some people in the jury that they don't know what these words mean, or what any of this freaking drug lord, he's like in Colombia, piles of amounts of cocaine, and it makes it sound like that, because it's not really. You will think it's an hour and 45 minutes testimony that is clear, and it's not. And I listened to it back and forth, and I don't think that Dr. Kipper was trying to throw Johnny under the bus, but I don't think that they're asking the right questions. But it was a video deposition, so the dude is not there in person. Maybe if he's there, that would be actually a difference too, but maybe he will be there. I don't know if anybody knows. So he's going to be there. List of drugs and medications, and how he didn't explain what was for. Like, I know when I heard the word Xanax, Valium, Klonopin, opiates, Percocet, Vicodin, I know what those are, but I don't know if everybody else does in that jury. So I kind of, oh my God, my hair's all over the place. I'm going to make some tea, like I do as usual. And then I'm going to keep listening to this, but I really have not found anything besides, well, he was taking this and then we went to the Bahamas. First of all, I don't know who had the idea to do a detox in the Bahamas, like going, on a plane. Because when they got to the Bahamas, Johnny was probably so sick from detoxing, but detoxing on a plane, I know this is Hollywood and why not, but that's like pretty freaking ridiculous to me, and it's actually pretty dangerous. And I'm gonna say one thing that get it out of the way. I think Johnny is lucky to be alive because one way or the other, if maybe allegedly Amber maybe forgot, I'm saying, to give him his Xanax or the stuff that she was giving him, maybe he could have a seizure by not taking the benzos. The problem with benzos is like, okay, you go to your psychiatrist and say, I want to stop the medications I'm taking. Okay, cool. They have to wean you off. And if the person in charge to wean you off is Amber Heard, are you sure you want to have that person next to you during a detox? Because what about if she doesn't just give them to them? Not saying that she's gonna poison him, or I am just saying like even by mistake she could have it. I mean, like I'm just saying he's lucky to be alive. I still think he's lucky to be alive. That's because he could have a big ass seizure just from the lack of Xanax. If you are in 3 milligrams a day and then you go from 3 milligrams to 1 milligram, you're going to be in trouble. You're going to have withdrawals, you're going to have headaches, you're going to have fevers, you're going to have shakes, and you can have a seizure. And I don't think that Amber knows anything about that. So I understand the doctor saying, well, in the early hours of the morning and late hours at night, the nurse wasn't there. So who was there? The fiance, because the moment you say you're somebody's fiance and then you marry somebody, buried. It's like, you're trustworthy, supposedly. But I think it was a big mistake that the doctor didn't put a nurse 24/7 and let Amber administer the medication to Johnny, especially when it's something that if it's taken too much of or too little of, it can cause a seizure. So, I mean, I'm just glad that he's alive because this could have ended really, really bad. And I'm not saying that she would do something on purpose, even by mistake, on accident, even by being like, being all over the place. She's drinking wine. Maybe she forgot. She went to sleep, but he didn't get the dose of the Xanax he needed to get, or the Valium, whatever he was taking. And he's not being weaned off properly. It can cause, I mean, not only the withdrawals are horrible of anything. Like the withdrawals are bad, even like this little antidepressants. If you stop taking them all of a sudden, it's gonna be bad. And you're supposed to be taken care of. And I just, in my opinion only, I don't think she's the person to have next to you when you're trying to detox. So don't know what the fuck, Dr. Kipper. But okay. So I'm gonna just keep listening to it. I'm not saying he's a bad guy or he's a bad doctor. Johnny seems to like him. Johnny's like smiling at certain moments of Dr. Kipper talking, especially when Dr. Kipper said that Johnny texts him, I don't want to do this anymore, like fuck you, whatever. And Dr. Kipper texts Johnny back saying, I know what I'm doing and stop trying to fire me. And that's something that happens a lot to therapists and to psychiatrists in general, because it's like the person thinks they know what they're doing. Like, fuck you, I don't need to. Fuck you and your fucking treatment. Da, 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 da. And I can totally see Johnny maybe doing that. Not because he's a monster, just because he's human. And part of recovery is fail, you recover, you fail, you recover, you fail, you relapse, you recover, you relapse, you recover. Relapse is part of recovery. And anybody who knows a little bit about addiction will tell you this. Amber Heard wants to make it sound like he was just such a crazy, horrible, freaking drunk all the time. But I don't think she understands relapsing and recovering, because I don't even think that she ever wanted to recover. Do we have anybody saying that Amber ever went to rehab or to detox? I haven't heard anything yet. For the last few years that we've been like just talking about this stuff or whatever. Not one of her friends, not herself, and not Johnny, nobody ever mentioned Amber trying to get help for her addictions, or whatever they happen to be. So it's kind of really, it's really unfair to put it on him. It's expected. I expect this to go this way. I knew that after that gigantic foundation of the testimony that Johnny's sister gave on the first day, and it was heartbreaking, and it was the boom. I knew after that it was looking too good for him. So they were going to try to do something regarding the drugs, the drugs. Like for reals, like opiates and benzos don't make you punch people in the face. If you are a monster and you are a violent asshole, you're going to do it no matter what it takes. But I don't think this is the case. And I just wish the doctor made distinctions between what was legal and was not legal, because I can see the regular Joe out there listening to this in court on TV and be like, oh man, look at all the stuff he was taking. And it sounds like a lot, but it's actually not. If you take a medication for bipolar, you got to take it like they call it cocktail, which is funny, right? It's a cocktail of medication. Sometimes you got to take up to 4 or 5 different things. And some are too up, some are down, some are uppers, downers, some are mood stabilizers, some are sleeping pills, because bipolar people usually have a problem going to sleep at night by turning off the brain and just actually resting. And this is something I know about, right? So I was kind of turned off by the testimony. I mean, I kind of liked the way he was not throwing Johnny under the bus. Neither Amber, really. He was being very neutral, and I liked that he was being neutral. He was not playing dirty, but I wish that he gave more details about the diagnosis instead of just saying, well, he was having issues. Well, he was having issues with opiates. Well, he was having issues with Amber, but not really going into the thing. And dude, like the biggest thing with Dr. Kipper that I was waiting for was the finger. Remember the finger? Remember when allegedly she cut his finger? And allegedly he protected her by saying that he cut himself by accident. Allegedly he said all that because that's what people get abused do. They protect their abusers. And I think he's been protecting her for a long time. That's very sad. But why Dr. Kipper didn't say anything? Dr. Kipper said that he was called in during that incident, but he didn't treat Depp. But Johnny Depp was treated in an emergency room. And I hope that they have that doctor coming to testify, because that's the doctor that knows and what was going on with the finger. If the finger looked like it was sliced, if the finger looked like it was like a punch and then it cut, if the finger looked like it was it wasn't broken, it was just a tip. But they had to do surgery on the guy last minute on his finger. So you will think that doctor knows what's going on. So why we're not listening about why we don't have that doctor on the witness list? I don't know. We have the guy that is going to talk about the cocaine and the opiates and all that. But why we don't have the emergency room doctor? The ER doctor that put the finger back together is probably the one that knows exactly what we are just all like here speculating on. And I'm not throwing anybody under the bus. I think the doctor did a good job he did a good job at explaining the stuff that Johnny was taking, but he didn't explain why Johnny was taking what he was taking. And he made a big mistake as admit that he let Amber administer the medications to Johnny because it was too early in the morning. Listen, there's like nurses that work for you 24/7, especially for the type of people that can afford it. I don't know why nobody was there 24/7 and why they were there like maybe 18 hours a day, but then the rest of the time it had to be Amber. I will not put my detox in Amber Heard's hands. I'm just saying he's lucky to be alive because of that combo of those medications he was taking, the opiates plus the benzos, plus the alcohol. If she made a mistake, and I'm not saying try to off him, I'm saying if she made a mistake by giving him the wrong dose of just forgetting, be like, fuck, forgetting. He could have a seizure. He could have a seizure like freaking like any, oh gosh. I'm so happy that he's still alive. But anyway, that was like the thing. And then I don't agree with the whole Bahamas detox. I think that's just crazy. I know these people are famous and they're rich, but like it's not realistic. And obviously, the doctor said that Johnny texted him twice saying, fuck this, I don't want to do this. yeah, I mean, like he's in the Bahamas in his own island drinking whiskey, whatever. I don't know why you think that is you have to put the person in a sterile environment that they're really gonna go like, I need to get clean, or else there is no other. There's just death. But I don't think he was put in a situation. He was kind of like pamper, go to the Bahamas, which is gonna give you a little bit of medication in the Bahamas, and you're gonna feel better. And no, and the problem was like even when he wanted to get better, the doctor said his text messages, Johnny's texts were like, I was doing okay. Now I got in a fight with Amber, and now I want some yum yum, because I don't know if you all heard it, but it's there on YouTube. He said some good yum yum that would knock me off to sleep, because she was driving him insane, allegedly, so he couldn't sleep. I think Johnny has problems sleeping, period. But at least he's one of those people that don't. It's like a night person anyway. And this is not a cocaine thing. I don't do cocaine, and I'm a night person, all right? There's no cocaine needed to be a nocturnal person. But I believe that he had insomnia, broad issues, right? Let's say he had insomnia his whole life, whatever. But the fact that Amber was like a vulture at him over and over and over and over, begin like driving him crazy with panic attacks and anxiety, for him to just say to the doctor, fuck this, I don't want to detox anymore, just send me some num num. Those are the words they use, because I need to sleep. So you wonder, will like, if she wasn't around, maybe he would have been able to just detox and get better, or maybe not, because maybe he wasn't ready. Because when you're not ready, you're not ready. So a lot of people are putting this on Amber. The only thing I'm putting on Amber is that I don't think that she had the knowledge or the wisdom. Wisdom and knowledge are two different things, okay? The knowledge or the compassion or the will to do it, to kind of like get up in the morning and take care of him and give him his meds. I just don't think that I don't think that she would be good to do that with anybody. Sorry, Amber Pants, but I'm just, so yeah, I'm just gonna try to keep. I really am trying to wait for the diagnosis part, but I listened to it over and over again, and I can't. It's like when they said that Britney Spears needed to be in a conservatorship because she had dementia, and they never really told us. This is the same thing. It's like, well, he might have bipolar, he might have this, he might be manic, he might have anxiety, he has insomnia, but it's pretty much it's like this Beverly Hills doctor giving you whatever the hell you want because you're Johnny Depp. And then trying to help you out to get clean after all the stuff that he's been giving you for, I don't know, 20 years or so, and putting your fiance on the making her your nurse. I need to look that up. In fact, I know that he didn't do anything illegal, but I wonder, if something happened to him, besides would be Amber's fault for messing some of the medication up. Maybe she forgot, but also the doctor should be accountable, because this really sounds like Michael Jackson when he died. Remember when Michael Jackson couldn't sleep? So Michael Jackson, had a guy in his house, a doctor supposedly, that was giving him something that is in the slang they call the milk, which is a type of anesthesia. It's not milk, but they call it milk, that you only can get after surgery, and you only can get in hospitals. It's not something that I can take home and lay down. And Michael was getting that from this guy. And when he died, allegedly he died. The doctor went to the bathroom and Michael Jackson freaking died because he was injected he was getting injected is not a problem. The problem is that the medication went there too fast, or the doctor went to the bathroom. First of all, that to me, that's a whole conspiracy. I don't even think that he died like that. But let's say that he died like that. That shows you there is staff that can be with you 24/7. Not getting up to the bathroom and then you end up in the floor dead like Michael Jackson did. Whatever you like Michael Jackson or not, it doesn't freaking matter. But like this whole thing with Johnny detoxing in private and all that with private doctors really reminds me of that. And it gives me a really fucking vibe. And I'm so happy that he's alive. And he's in one piece, really, because he could be like paralyzed. He could have a seizure. He could have like a brain stroke and be like look like that, but be completely out. So you can actually have brain strokes from stopping these medications. You can have seizures from weaning off too fast from Xanax. So, dude, I am just, oh gosh, I'm sorry. I'm just dwelling on the same thing because I can't believe. Is it job working? Sorry, I just saw it. It popped out. It's still working. I don't know. As usual, I don't know. My kids just left, so I don't get in here when they're here. So they just left with their dad, and I gotta go to work in 30 minutes for the night. So when I come back tomorrow, I'm gonna try to get some sleep, but then I'm gonna probably like get up around 12 p.m., catch up, watch the trial, whoever is, probably Stevie Ray or I don't know who's gonna live stream, but somebody will. And then I'll make a video about that later tomorrow. Because right now I gotta go to work. But I just want to pop in here and see if anybody else thinks or agrees with me or disagrees, or do you think the opposite? That I do think that was very responsible for the doctor to give Amber the power of just administering medication to anybody who is detoxing. And I think the thing with the fucked up thing is, this happened to Amy Winehouse, the singer. Sometimes the drugs won't kill you, but the detox could kill you. And the detox is as important as the quitting of the drugs. People go like, oh yeah, well that dude is too fucked up. He needs to quit. How many times you heard that from people? Go out of whack and your vision is going to be fucked up. And sometimes you lose your sense of smell. Sometimes you start hearing things. Detox are horrible. And they were not a thing to put in the hands of anybody's wives or fiance. Even if she was a really nice and a good person. I think that was very, sorry, my back hurts. I think that was very irresponsible, dude. Sorry, Dr. Kipper. But overall, like, if it wasn't for that, then he seems okay. I like that he said on the deposition by video that he never witnessed violence, that the text messages were like, we're having issues, Amber and I are at it again, stuff like that. She's driving me crazy. I need some pills to go to sleep. We are having issues. We are not doing good. Those are the statements that the doctor read from Johnny. There was nothing like, oh fuck, she got hurt, or like just nothing. I mean, besides like another going on his sense of humor. We all know, if you didn't know that, you know now that Johnny Depp is kind of like a potty mouth, the way he's texting people that he likes or he loves. When you have a doctor for 20 years, you cannot develop a relationship. So texting your doctor that you know for 20 years is not so rare. I know they're going to try to make it sound all dirty, because there's a text that the doctor said, I love you, brother, everything's going to be okay. And that is not that rare. I mean, I've said that before to people. People said that before to me. And it's like, really, you love me? Well, no, not really. It's not like I love you, that I really love you, want to be with you. But it's more like, I respect you, I love you, man. Like, I care for you so much. I love you. Sometimes people drop that. And a lot of doctors or therapists, they shouldn't. But after 20 years of knowing somebody, hey, saying I love you, I hope that you feel better, I don't think it's such a big deal. But I have a little tiny feeling that they're going to try to go, maybe the Amber people are going to go on that a little bit. And then they're going to bring up Marilyn Manson. I can't wait for that to happen. And the whole binge that they wear, because they mentioned Marilyn Manson in the opening statements. Amber Heard's, the thirds, we can call the thirds, Amber's team mentioned Marilyn Manson as this person who was just giving drugs and who they were in a binge for like 3 months or whatever. So it seems like the more that he tried to recover, the more that she was like sending it back, but not because, oh, she tied him out to a chair and told him just don't do this. It's really sometimes like a person can, and it doesn't even have to be physical abuse, really. A person can put you in a state of mind that you are really okay, fuck it, I'm not doing this today. I can quit next month. Right now, I gotta deal with this crazy bitch, so I need my pills. This is kind of what I will think that his state of mind was. Not like, oh, I want to be a drug addict, I'm choosing. Nobody's choosing to be an addict, okay? It's a freaking disease. So I don't like that they're treating it like kind of like it was his choice. The doctor said something of the sorts of like, well, he wasn't ready. He told me he wasn't ready. Dude, it's like, no, they're not ready. He wasn't ready then. It has nothing to do, it's not really so much of a choice. You either stop because somebody makes you stop, or you die, or something major happens in your life that you're like losing all your money, you're losing your house, you're losing your wife because she's leaving you because you're freaking drunk, and then you stop. Something major has to happen. People don't just wake up one day and go, I think I'm not going to take pills anymore. It doesn't work like that. So it's very, I don't know what the fuck her team is trying to make us think that this was a conscious choice by him. Like every day he wake up and be like, I'm going to take drugs today. No, I don't think so. I think it's the same reasons that maybe that she needed to get drunk to deal with this whole madness because they're arguing a lot. He needed to get high because she was driving him insane with her insecurities and her jealousy. Johnny's sister talking about how jealous and how insecure she got, that every time that he would be out of town, she would get insecure because she would think that he was with the other actresses, that he was cheating. So insecurities can make you do that. Just, drink a whole bottle of wine to feel better about yourself. I hope they talk about her wine drinking. Pure wino. And listen, it's legal. Wine is legal, but it doesn't mean that it's what she was doing was okay. You have a person who drinks a lot of wine and drops acid before Coachella, does ecstasy, allegedly has ecstasy in her purse during her wedding. You have that person administering medication to this guy. Really? See, when you put it that way, it's like, dude, all right, I'm just trying to, sorry, I keep interrupting the video. But the sound volume is not working right here for my phone. Sorry about that. I'm really tired.
Yeah. Addicted to any other prescription drugs?
No, other than opiates, no.
What is roxycodone?
It's an opiate.
An opiate.
And what is Adderall?
It's an upper.
Adderall is a stimulant.
Adderall, because Adderall was given to him for ADD, because Johnny has that. So they're mixing up things that are legal with things that are not legal. And I hate that they're doing that. I'm going to get my, I'm so all over the place today, my charger, because I have ADD as well, just like Johnny. But I don't take Adderall. But I'm getting my computer charger so it won't die. My point here is like, dude, if you're going to list a bunch of drugs or anything, you have to, sorry about that. All right. You have to say what they're for. Adderall. Okay, I know what's Adderall, but like the jury's not gonna know. The jury's not gonna, they're not able to research it or look it up. I mean, like, come on. I know it's not crack. I know it's a stimulant, and it's been given to kids they have ADD. It's not a drug that's gonna kill you. I mean, I know people that done Adderall their whole life, and they're just fine. And they did it so they can finish their college. They did it so because they couldn't they couldn't focus. Otherwise, they were just all over the place. I know people that actually had abused Adderall and sniff it. Dude, but if you're not going to make the distinction why Johnny was taking the Adderall, you just say like, well, he was prescribed this. That's what I didn't like about Dr. Kipper. Everything was very, very vague. It's almost like he was talking to people that know. These people don't know. Well, the lawyers know, and they're trying to trick us with this. And I know, you might know, but the people in the jury, do they know? Do they know what? I mean, everybody knows what an opiate is, right? But they know the difference between Vicodin, Roxycodone, Oxycontin, Percocet. They're not going to know. So if you throw those names out there and you don't explain why, you're almost like painting, you're painting a bad picture. But I don't even think he was doing it on purpose. Because he's in the witness list for Johnny. So I don't think he was doing it on purpose. I just think that he was being very matter of fact, that he was trying to be neutral. And he also is a very high profile doctor in Beverly Hills, and he's not going to look like, oh my God, all emotional. He's not going to be like Johnny's best friend, because he has a lot of famous patients. And he's not going to look like, the snitch. But a lot of these guys, they work with famous people for years, and 10 years, 20 years. Come on now. Sometimes it's just a phone call away when you need something. And that's what I compare it to Michael Jackson, because Michael Jackson was abusing the fuck out of that because he had people helping him out. So it's the same thing. We're ever going to know why Johnny was taking this? I have an idea. Of why. Like he mentioned it before, he gets ADD, he gets hyper, and then he gets unfocused, and then he mentioned that he gets not violent, bipolar. And all right, cool. In 2 hours of testimony, he didn't mention the word bipolar once. So what it's gonna sound like, he's taking all this stuff because he just wants to, or he's chasing after some dragon, some type of high. And if he has bipolar, which I think he does, then what he's taking is not really abusable. Let's put it that way. If you have really bad depression, chronic depression, and you're taking a stimulant, you're not gonna get high because your depression is so low. But if I take that, I'm just gonna be up and down the freaking. I'm gonna have a heart attack. So I wish there was more clarity in why he was taking what he was taking, instead of just dates and the name of the drugs. And again, the Bahamas detox to me with Amber as a nurse. And they were calling outside. Oh, I'm sorry. My phone just went. Nobody needs to get on TikTok right now. Jesus, so much stupid shit. That's why I don't have it. Why TikTok needs to give you an ad? Like you want me to get it? Like you don't have enough clicks as it is already. Jeez. I'm really trying. I was reading about this guy, and I know he is a good psychiatrist, but I don't understand. Kind of checked it out, and he didn't talk about the finger.
What is Xanax?
Xanax is a benzodiazepine.
This first paragraph on this page, these are notes based off of your discussion with Mr. Depp.
Yes.
And then on the second page where it says physical examination, that's just what you conducted at the time on Mr. Depp.
Yes.
The guy's like, yes.
Where it says impression on the third page, that was your impression of Mr. Depp at the time of May 22nd, 2014?
Yes.
2014. It's like.
And under that,
how can you even?
That's documenting your plan for Mr. Depp going forward?
Correct.
Mr. Depp paid for this visit?
Yes.
When was the plan to start this treatment of Mr. Depp?
After he completed his current.
Dr. Kipper, do you recognize Kipper Exhibit 4?
Yes.
And what is Kipper Exhibit 4?
It's a progress note.
Oh, the progress note.
June 11, 2014.
And did you keep these notes in the normal course of business?
Yes.
And did you take these notes?
Yes.
And the notes are meant to be accurate, correct?
Yes.
What is
He's calling him an idiot. Do you take these notes for this? Because redacting and redacting and redacting and redacting, not this is like a gigantic freaking case. Not because they're famous, because the gigantic freaking case of $50 million. Okay, it doesn't matter if it's Johnny Depp or it's like Joe down the street. $50 million. Okay, and these people, both sides, were kind of unprepared on Thursday. That's like my opinion. It was Tuesday and Wednesday was not bad, but Thursday was like, dude, a mess. And even Judge Penny said, "Well, I hope the next week you guys can put that together." Dude, get this whole redacted thing going on done. I don't know why. I don't know if it's nerves. Yeah, probably. I mean, I don't know. I'm not a lawyer. It's probably so fucking hard to be there on camera. But I don't know if it's nerves or what. But they were both, Amber's side and Johnny's side, so disorganized when it came to the redaction, the prints and the copies and the stuff. It's like the judge was like kind of reaching. What do you think? Can I have this? Can I have this? She shouldn't even have to ask. That's what they have. It's Johnny, two people, and then there's two more people there. Is Johnny, the female lawyer, the male lawyer, and there's two people behind him, the paralegals. There's a total of 5 people there. And you're going to tell me 5 people couldn't get this stuff straight up for the judge so she doesn't have to ask over and over again? I thought that was like, that kind of looked bad. But Amber's lawyers did it too. So I guess that's like equally bad and equally disorganized. But again, I'm sure it's a really hard job. I don't know. I don't understand how people can be lawyers and defend somebody like Amber Heard. Can you imagine that? Can you imagine? Because everybody deserves a fair trial, it's in the Constitution, right? But like, can you imagine, you're doing this career and you think you're going to do a good thing for the world and you're going to make a difference. And then you start working in a law firm and then you do your internship and then they give you somebody like freaking Amber Heard. My God. And even if you're just a paralegal, you're not the main attorney, that has to be such a pain in the ass to just deal with this type of chaos. And I'm not saying Johnny's not chaotic, but she is worse. Because at least Johnny has the truth. When you have the truth, you can be chaotic about the truth. You can be messy about the truth. But you got the truth in your hand, and even if it's really hard to explain, and even if he goes there with his hair all messy, who gives a fuck about the hair? People need to stop being so fucking stupid online. He should have gotten a haircut. One of his hairs costs more than your whole fucking apartment. So people need to stop talking shit like that. Like, I don't care. Like, I don't care what she's wearing. I don't care. I don't talk about stuff like that because I don't care. I mean, does she looks pretty? Yeah, she looks pretty. Does she looks whatever? Like, I don't care if she has a bra on. So many people online are talking about her bra. She doesn't have a bra on. She looks like a captain of a ship. She looks like a man. I mean, this is like, he's lucky to be alive. That's what I'm going to say. And like, y'all like talking about the hair or her hair or her plastic surgery. Will you like her more if she didn't have plastic surgery? So it's not necessary to point at that anymore. Dude, like, I would just wish that people focus on what these people do and their actions instead of the way they look, because that always pissed me off about the internet. And that happens like with anybody, from Britney Spears to like Joe down the streets to Johnny Depp to anybody. It's always like, oh, but you see what she just did? You see what she posted? Oh my gosh. And then you wonder why people take drugs. Why these people take drugs? Because of people like Amber and a lot of older people. They go like, you're too fat, you're too old, da 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 da. And I feel like with her was a constant fucking criticism from her. I kind of had a feeling, and I got that feeling before Johnny's sister actually mentioned it. I never knew that Johnny had a sister that knew so much about Amber and him. I thought that his family was stranded. I didn't know that the sister was working for him or with him. But the first time that when I heard the sister testimony, I cried because I couldn't believe how heartbreaking it was, how horrible it was. But I also was like, this woman, like, she knew this, everything that we're being saying about Amber, and we don't even know this person at all. she was kind of confirming everything, that Amber was like driving him crazy, that she wouldn't let him sleep, she wouldn't let him eat, she would call him fat. She would say that, oh, why they want you to do the fashion campaign for Dior? Why Dior will want to work with you? You don't have style, you're a fat old man. And these are things that I thought in my head that were happening to like me when I was younger or to friends of mine. But I can't believe they're happening to somebody like him. Like if that happens to Johnny Depp, it can happen to all of us. Like the toxic, narcissistic bitch. Raven. Yeah. And it really pissed me off. They're talking like it's a fashion show. And you know also what pissed me off? When I go on those lives of the streams to listen to what I'm gonna do tomorrow morning when I come back. Probably I don't know who's doing it. Who's doing it? So Monday was Come Geek Some channel. Tuesday was Stevie Ray. And Wednesday was Tuesday was Dr. Soups, and Wednesday was Stevie Ray J. Those three channels were live streaming. And you won't believe the amount of people they were saying, this is so boring. If anything is gonna happen, this is so boring. I'm gonna go to sleep. And I was like, I remember like typing, go to sleep. Nobody needs to hear. If you think this shit is boring, what do you think it's gonna it's court. And you're really supporting this guy so much, justice for John, that. And then you're going to get on the live stream, the big live streams, like thousands of people watching it from, like I'm saying, the big channels. And you're going to be like, this is boring. Look at her face. Look at her cheeks. Look at her nose job. She looks like Michael Jackson. It's like, shut the fuck up. Shut up. That's not important. The drugs are important. Why she was taking the drugs, why he was, why she was, all that's important. Not so much the what and the when, but the whys. And it's weird, like I said before, that this doctor didn't really give a lot of whys. He gave a lot of when and what. And it's kind of what doctors do. December 5th, 2015, 10 milligrams of Ambien. But why? Well, because he couldn't sleep. Okay, he couldn't sleep. Why he couldn't sleep? The urine test, he couldn't sleep because he was doing cocaine. He couldn't sleep because he was stressed out. He couldn't sleep because, like, there was not an explanation on this witness. I'm sorry, and I like the guy. I actually don't mind Dr. Kipper. The therapist sucked. The one that talked before him, the counselor, whatever she can call herself therapist. But oh my God, she was so bad. Raven, did you actually saw that? The therapist? Her testimony was meet with Johnny and then meet with Amber, and then meet with Johnny and then meet with Amber, equal amount of time. She spent a lot of time talking to Amber and maybe saw Johnny like 5 times out of the whole 2, I guess, like a year and a half of treatment. And that is a no. That's a no. You do couples therapy, or when you go with your partner to couples therapy, you cannot be the superstar, the monologue and the superstar of the treatment, because it's for both of you, for you and your boyfriend, girlfriend, husband, whatever. And it seems like this woman, not the talking, I'm talking about the other lady, the therapist, marriage counselor. See, that's the thing. When you are counseling a marriage, you're counseling a marriage, girl. This is more like she was just hanging out with Amber and talking shit. That's what it seemed, that it looked to me like that, because she even admitted that she didn't met with him too many times. And that is a no again, because it should be equal amount of time for both partners, not just a lot of time to the woman or a lot of time to the guy because he's the one paying, and less time to the woman, whatever. That really made me mad. She was a horrible freaking witness. I don't know why she was on Johnny's list. Maybe because I'm thinking, well, she did say about the bruises, but then she said she didn't see the pictures, but she saw something on her face, which it could be a lot of things. It could be makeup. It could be bruises from injections, because she does have cheek implants and injections. And it could be all that. It could be anything. Bruises, I bruise all the time. I don't mean somebody beat me up. I'm all bruised right now, probably. Like, it could be anything. But then she can retract it on the video. I don't know if you saw it. That they asked her, and she said, well, no, I didn't really see any pictures of it. So I don't think she was a good witness. If I have to pick from the therapist or Dr. Kipper, the psychiatrist, I pick him, because at least he was, he didn't throw him under the bus or throw her under the bus. Really, he could have. But I think he was trying to be professional because he's that dude. If you Google him, Dr. David Kipper, Beverly Hills, he's so high profile. It's not just Johnny Depp. It's a lot of people that he sees, and he has to be low key about it and not come across as super the doctor to the stars, and like this is the guy that you call every time you need a Valium or Xanax. You just call him up. No, he needs to come about professional, but at the same time, I think that he was too guarded, and I wish that he talked about Johnny more about his mental state instead of the drugs addiction and the drugs and the drugs and the drugs. I hate that. It just seems like I think half of this trial is going to be about the drugs, and I'm not being negative, but it's just kind of how people this day and age, you will think we evolve, but we're still talking about drugs more than anything else, instead of like looking at the reason why people do what they do, what they eat, why they have disorders, why they don't like themselves, why they have plastic surgery, why they do drugs. No, we're just talking about the what and the when, and we're not talking about the why. I keep saying that over and over because it really made me mad that he sat there and list, oxycodone, Percocet, Vicodin, Valium, Xanax, Seroquel, the mood stabilizer, Ambien, Valium, and he listed Adderall, marijuana, alcohol. Okay, let me do it again. Marijuana, alcohol, Adderall, Valium, Xanax, Seroquel, Percocet, Vicodin, Oxycontin. 9 things that if you don't know what these things are, you're like, oh my God, what a drug addict. And really, these are things that everybody takes. Everybody takes painkillers. Everybody drinks alcohol. A lot of people smoke weed. Half of this freaking city smokes weed. And the Valium and the Xanax, it's not that rare. So I don't like that they're treating it like it's just Johnny Depp taking Xanax, Yeah, you stopped. Yeah, no, watch Dr. Kippers. It's very interesting. I don't mind the guy. I like the guy. He seems friendly, and he tried to help Johnny so many times. So he's good in my book because Johnny seems to like him. If you watch it, when you watch it, you're gonna watch Johnny smiling a couple times because when Dr. behavioral addiction or substance addictions, that you're like, I'm done. I don't want to do this, man. I don't want to do this. I quit after Christmas. Fuck. And like in it seems like Johnny was doing a lot of that. So, I just don't think that should just be taken in. I think that's irrelevant. If he was just drinking a lot and being violent towards other people, because people that drink alcohol do get violent and punch people in the face. If he was doing that a lot, then okay, then let's. But we're crucifying a guy that freaking took some Xanax and some painkillers and smoked some weed. The cocaine is the part that I don't really like mixed with everything else, because I think that's might make him look like he got angry. Even if his sister said that when he was taking coke, sometimes he was like chill. Whatever, like nothing really made him too animated. Usually people will take cocaine and they will talk a lot, or they will get animated, or some people will get in fights because it's a stimulant, it's an upper. But Johnny will just kind of get neutral. And that happens a lot with people that have bipolar or people that have ADD. The when they take a stimulant, instead of getting more hyper, they get neutral. That makes sense? That's just what the medications do. So Johnny doing cocaine, to me, it doesn't seem like he was, the cocaine and then the alcohol and the opiates and everything at the same time, and then go and get in a fight with somebody. I think the cocaine was just part of celebratory, eventful thing, maybe party thing going on. I don't think it was like 24/7. I'm eating my bagel with cream cheese and I'm drinking my coffee and my cocaine, first thing in the morning. I don't know. Maybe I'm just blinded and I don't want to see that, because I do have a problem with people that I don't like the whole cocaine thing. But I actually understand why he would have the need to escape and to feel something. Then it's not violence. When all you're feeling is, all you're getting is scream at, slap, finger cut, whatever, all the stuff that she did, even if she didn't touch him physically, if all you're getting is constant yelling and constant criticizing, and you're old and you're fat and nobody likes you, nobody's gonna believe you, and your movies are horrible, blah, blah, all this stuff, you're going to want to get high. And I'm so sorry. So I hope that they actually go to that route and be like, well, why? Not just like list milligrams, the name of the medicine, milligrams. Let's just talk about the why. And I hope that they do that this week. It starts tomorrow. And also, I hope they start asking her questions. You know what I mean? Not her, but like her doctors, and be like, well, why Amber, why Amber takes what she takes? All right. And if it's legal, it's legal. And again, I do hope that people understand that relapse is part of recovery, and anybody who has a little bit of brain cell and knows a little bit about 12-step programs, that relapse is part of recovery. So just because Johnny relapsed like 3 times, he recovered 2 times, and then he relapsed 2 times, and then he recovered 3 times. It was an up and down, up and down. It doesn't mean that he was not trying. I think if anything, the testimony of Dr. Kipper makes Johnny look really good, because it makes Johnny look like he was trying to seek help, which I don't know if she ever was. Maybe you know something I don't know. Was she ever trying to get help? I don't know. Did she ever detox? So the fact that Johnny is there and has seriously the balls to have his whole medical history display, and he's doing just this to clear. He's not doing it for the $50 million. That number is there just to fuck with her. He's doing this to clear his name up. So it has to be so hard. So I hope that it's all, I don't have a bad feeling. I have a good feeling about that they don't have any proof that the bruises were real. Somebody's gonna come up and say, and they're gonna prove that the bruises were fake. I'm waiting for that. Like, not just saying it, but proving it. I'm waiting for that. That's gonna happen. But then also, I'm worried about the whole drugs and alcohol situation. So I hope that people in the jury are open-minded enough, and they don't look at him like, well, look at this guy, he's probably not job because he probably punches people and he takes a lot of coke. Because it's not that simple. And I know they don't supposed to do research on the case, but if you're not supposed to do research on the case, how are you gonna know? Like, how are you gonna know? I guess I wonder how that's gonna work. Like, if I was there, I don't know if I wouldn't get picked up for the freaking jury, because I would it's too close to my heart. But I'm saying, if they tell them not to do research, can they do research on the medications? Can they do something like that? Because if all they have to sit there for 6 weeks and listen to the witnesses, depositions and testimonies without asking any questions, because you're a jury, you don't talk, and without researching anything, then whatever they're going to believe is whatever they're presented with. And that's kind of when I think it gets a little bit scary for Johnny, because it might be a lot of, a lot of Karens out there, close-minded Karens, going like, look at him with all those tattoos and doing all those drugs. My God, he's a monster. He has tattoos and he does drugs. Just like Marilyn Manson. He has rings to his fingers, just like Marilyn Manson. Monster, I'm telling you. And also, they mentioned, I told you, Raven, they mentioned Marilyn Manson, right? In the opening statements, they mentioned Marilyn Manson. They didn't say Brian Warner. I'm glad that they say Marilyn Manson, not Brian Warner, because the whole Brian Warner thing is pissing me the fuck off every time the Evan says Brian. I hate that shit. So at least the guy had the decency to say Manson. Amber's lawyer mentioned Manson for like a minute, for like a second, half a second, but it was like, oh. So yeah, no, go watch Dr. Kipper and the therapist. So that is day 3 because there was no court on Friday, and then we chat about it. I gotta go now because I gotta go to work, but we for sure chat about it tomorrow. Raven, are you gonna be around tomorrow and tell me at what time, and then we can chat? But I don't know what time. What time is good for you? Right now is 7:20 p.m. West Coast time, and I gotta go. But I'm thinking that tomorrow, after the whole court date is over, and after everybody's doing their own thing on YouTube, maybe I just get here and talk for a little bit. But I want to go because I don't want to go after 1 hour. And I hope this makes sense a little bit later. I don't know. I'm mostly just speaking from my heart and from what I feel. And it's my opinion. Again, he's lucky to be alive. And I'm not saying this to punish him or criticize him in any way, but he's lucky to be alive. Yeah. And I'm lucky that he's lucky to be alive. We are fucking thankful that you didn't get off by somebody or fainted or have a brain stroke, because I thought all the medications that he listed, plus having the nurse Amber giving it to him, I was a recipe for disaster. I don't know, Raven, if you know about that, but the Dr. Kipper was using Amber as a night nurse. Yeah. The binge, Marilyn Manson. But I'm glad they say Manson and not Brian Warner, because every time I hear Brian Warner, even if I know it's his name, and Brian is a cute name, but it just every time I hear Brian Warner, no, I hear the name Brian now, in my head it's like Evan Richard Wood going like, and then Brian got so mad at me, and then I woke up and then it was a different Brian. So now it's like the name Brian. I have a friend, his name is Marcus Brian, and I cannot call him Brian anymore. Evan Richard Wood fucked the name Brian for me. She fucked that name up. I'm sorry out there if you're Brian. Yeah. People call him Manson unless you're his wife. Yeah, people call him Manson. So for her, when she goes Brian, and then in the scene next to her, she goes Manson, and then it's Brian, and then it's Manson. It's when you and I know why she's doing it. Yeah, I gotta go. I talk to you tomorrow for sure. Good night. I will talk to you tomorrow. I'll make a little comment and I will let you know, and then you can let me know, and then I'll let you know back. Yeah, go watch Dr. Kipper so we can chat about it tomorrow, because then we can catch up. Thank you, honey. Talk to you later. Bye. Good night.